are about to conclude in a few minutes from now, but still we have some interesting discussion to happen. We have been talking about what are the Global South voices that should contribute to the upcoming revision of the Global Action Plan on AMR. We've had about 6 very rich technical sessions, about 20 Global South countries coming in, representations from the Global North countries, about 100 participants and close to 75 interventions. Lots of discussions, lots of nuances coming out, and lots of enriching points that is fed into the discussions. I am very happy to welcome you all to the last session of this workshop, which is about the wrapping it up and the next steps, and also discussing what are the key takeaways. And without much delay, I just hand it over to Sunita ji, who's the Director General of CSC and also a very important member of the Global Leaders Group on AMR. Sunita ji, over to you. Yeah.
Thank you, Rajeshwari. Thank you, Amit. Thank you, Neeraj. I have been hearing from you and watching just the complete amazement to see the number of voices that have spoken and with such passion, commitment, and knowledge. And I think that's really what is so important for us, because from the Global South, we have a perspective, we have a reality. And this is not to say, I'm not trying to make the differences between the North and the South, but just to recognize the fact that there is a difference in the reality in our part of the world. And that recognizing that reality, we can have a better conversation, a better dialogue, and a better action plan. Because at the end of the day, we need action across the world. We don't need action only in the Global North or in the Global South. We need action across the world. And to have that action across the world, we need to have this understanding of the realities of our countries and what makes the best sense for us to be able to act moving forward. What has really encouraged me, and from also when I spoke with my colleagues and their takeaway, is that every speaker has focused on what needs to be done. We are no longer talking about the problematique. We all are part of understanding where the problems are. And I think for many of us who've been on this journey together, I can speak for a lot of us to say, we have in a sense grown up today to know there is a problem. It is real, it is urgent. The question is, what do we do? And the question now is in front of us, and I can see JP here, so thank you very much for joining us, JP. The question I think for us is, how do we make sure that our perspectives, our knowledge can be part of the Global Action Plan as we move forward? We know we are grown up in this business. We know that everything we say is not going to be included, but I think the question is not the words that get included. The question is the reality getting included, and therefore the answers to our reality getting part of the solutions as we all move forward. So with that said, let me thank you all, but straight away jump to the chairs of the different sessions. And I saw Rajeshwari is going to take on the task of sorry, Rajeshwari, to dump this on you, but very grateful as you will make the presentation on my behalf for the first session. Please go ahead.
Yeah, thank you, Sunita. It's always a privilege to take forward your mandates. On that note, I want to first quickly mention that we are live streaming this session. Apologies, I forgot to mention, but for everyone's information, this is being live streamed on YouTube. And I will now share the screen. Yeah. So, as mentioned, I'm presenting on behalf of Sunita ji the key takeaways from the first session, which was about towards sustainable food production systems and its role in preventing antimicrobial resistance, zoonosis, and climate change. So clearly, the discussions were targeted on two kinds of farming systems: one on smallholder systems and the other on intensive farming systems. What came out were that smallholder farming systems are sustainable because of the benefits that goes beyond reduced antibiotic use, the benefits which are linked to livelihood and nutrition security, climate change mitigation and adaptation, conserving biodiversity, safe food, waste management, and its importance in circularity. It also emerged that smallholder farming systems is a reality in our part of the world, a reality we cannot do without, and there is a need to recognize that this system has an importance and role and play an important role in our part of the world. This role cannot be negated or dismissed by believing that they will not function or work towards a sustainable food production model going forward. The need to promote and support such kind of smallholder farming systems was also something which came up very heavily. And the promotion and support in terms of increased access to veterinary guidance, low cost, affordable diagnostic kits, vaccination, biosecurity, good animal husbandry practices, similar access to extension services, access to local distribution networks, the need to find market access for smallholder farmers, carrying out backward integration, the role of affordable and manageable certification systems, which does not become a burden for the farmer, instead becomes pro-farmer, was also discussed. And also the importance of how economic incentives can help farmer change their behavior. Looking forward to approaches that are socially embedded, economically accessible, and culturally relevant was believed to go a long way in encouraging these kind of farming systems. In the context of intensive food animal systems, it came out that their sustainability is not as much as we can see in the sustainable smallholder systems, and there are multiple reasons for it. They are, in fact, a convergence point for zoonotic outbreaks, AMR, environment degradation, climate change, although there are approaches by which these impacts can also be reduced. And so, in the upcoming Global Action Plan on AMR, it is important to recognize these linkages, the impact of consumption of meat or food from intensive systems, and the need for promoting production and consumption of sustainably grown food. There is also a need to reflect and capture on the connections between intensive food animal production systems and pandemics and climate connections, such as those related to land use for feed versus food and GHG emissions. On the solution side, experts also commented that intensive systems contribute to food security needs. Enhancing animal production to meet the global population requirements for food is something which is crucial, and intensive systems have a role to play in meeting this growing demand for animal protein and food security. However, within this, also prevention can play a big role in getting these systems right. For this, there is a need that there is a heavy investment made in preventing diseases that constrain intensive food animal systems and their scale up. It is also recognized that they can be a part of the solution once disease preventative measures are applied in a systematic manner. And for this, there is a need to differentiate in intensive systems what good practices and poor practices mean. The importance of commitment to a short term phase out of antibiotic growth promoter use and a long term phase out of routine preventative use of antibiotics for group treatments was also something that was put on the floor. So I will stop here. Sunitaji, I've just laid out the key points that were discussed, and of course, there was more that was discussed.
No, absolutely. Thank you very much, Rajeshwari. You've done that's a very good capture of what we have discussed. Amit, you were chairing the second session. Can you give us the takeaways from that session?
Yeah, I'll share the screen. Yeah, so
can you make it full screen, Amit, please?
Yes, I'm doing that. Okay, so this was a second session on day one. There were about 10 interventions, and I'll just quickly summarize them. Uh, so at a very broad level, if I may say, it's more like a context setting here that agriculture and livestock is critical to a large part of global South population, particularly rural population. And agriculture is and should remain livestock centric and not really chemical centric, because it will also help other aspects of the agriculture. Prevention interventions are good not just for animal health or welfare, but also public health, environment, and ecosystems. And there was this consensus that zero draft reflects preventive approach well integrated across One Health sectors as well as different elements of the zero draft. But there are clearly challenges, possibilities, and realities of the global South that need to be reflected in the updated global action plan. First and foremost is the challenge of awareness, knowledge gap, or correct information. At the level of animal health workers, vets, paravets, farmers. There's a need to shift in the way the awareness is created towards more behavior change and participatory approach. Awareness that antibiotic use is not prevention and there are alternatives. Also need to know about alternatives. And it was felt that demonstration farms, farmer field schools, training of the community animal health workers can help. The second challenge was the challenge of the why a farmer would focus on prevention, which is also linked with the first challenge. The question that why should for a farmer, it boils down to AMR versus productivity, and he or she would choose productivity. So where a farmer sees value, the challenge of economic case, the incentives, the subsidies, and who will pay for this change. The third cross-cutting challenge was the challenge of affordable access to solutions. This includes all the preventive solutions, vaccines, veterinary services, specifically in the context if antibiotics remain cheaper and come across easy solution. And the fourth challenge, of course, is the importance of, it's not a challenge actually, it's a solution, the importance of local solutions, including EVM, vaccines for local strains, for local relevant diseases, uh, localized plans which have local implications, local benefits, so that the behavior change, to cause the behavior change and ultimately make these solutions sustainable. Now, specifically, if I may say, preventive interventions needs to be customized because they depend on extensive or intensive farming systems. They also differentiate in terms of species-wise. There needs to be adequate focus on process-centric preventive solutions, for example, farm management, biosecurity, in addition to the product-centric solutions such as vaccinations. Uh, Veterinary services, it was felt that there's a high cost of veterinary services, particularly for small farmers. There's an issue of their accessibility and correct information, and therefore there needs to be strengthened, including improvement in the diagnostic services. When it comes to biosecurity, everyone felt that it was very important. Large-scale commercial farms do have the capacity, and because there's a cost of not doing it, but it was also important to have animals free from pathogens before they entered the production. So by and large, biosecurity is very critical, and the biosecurity audits can help. When it came to vaccination, it was very clear that vaccination is popular, but the issue with vaccination is availability with reference to the relevant diseases. There is a need for vaccination strategies and schedules for all animals, and a lot of that needs to be customized. Focus also needs to on the laboratories, production and manufacturing facilities, quality control, availability of vaccines for local strains, and of course, very importantly, the issues related to handling, storage, and cold chain infrastructure in this part of the world to basically avoid vaccine failure, in addition to the high cost of vaccines. Um, the issue of access, as I mentioned, affordable access of all preventive solutions. That is very, very critical. Uh, Now, the other part to this is in terms of alternatives. It was discussed that probiotics are more popular among others. However, the need for more research and alternatives in general was felt because of the wide spectrum of it. It starts from probiotics and then towards phages. There, of course, are some quality issues, but overall, it's a growing field and there are a lot of options available. Traditional solutions like ethno-veterinary medicine are a good alternative, and there is a need that to highlight their importance because they are feasible, they're cost-effective. There are success stories from Malawi we heard, from India we heard. So clearly, this is a very important area. How to convince farmers why they should do it, as I said earlier. What is the cost of AMR? all that is important, but most important is empowering the farmers, because that they are the right stakeholders to take the decisions for themselves, and they need the right kind of information and solutions. Access to clean water also came up very importantly. I mean, very critically, it can prevent a lot of diseases. Often it is only talked in the context of human health, but not in the animal and food animal setting. So therefore, the importance is very high when it comes to preventive solutions. Uh, it was also very clear that it needs to be highlighted that antibiotic use as a prevention is not the real prevention, and it should be phased out, particularly because of the fact that if growth promoters are phased out, there's a high chance that this part of the preventive use will increase. So both need to be handled in parallel. There's an issue about monitoring and controls, and of course, with the antibiotic access. And it was clear that everybody was clear that we need to stop the OTC sales. A lot of falsified and spurious antibiotics are an issue. Poor quality products are also important because they will help. Waste management also came across as an important part, particularly to prevent the cross-sectoral transfer, including litter from poultry farm to aquaculture as a fertilizer, AMR safe waste for land application of manure. Some other approaches were discussed, including improved breeds, environmental controls, and proper housing. So, by and large, a very important discussion, if I may say. And with that, I submit Sunita ji.
Thank you, Amit. I'm going to go through all the chairs and then open it up. And we have JP for his remarks as well. Sabiha, can I now request you? And again, thank you so much for agreeing to chair the session. Really grateful.
Can you hear me?
Yes.
Thank you very much, Sunita. It was a pleasure to be part of this discussion. And I commend again the CSE for taking this up on behalf of the Global South. It's really been very, very enlightening and really good to hear all of the Global South voices. Can you see my full screen now?
Not yet, but I think, yes, now we can. Thank you.
Okay, great. Wonderful. Thank you very much. So my session was on mainstreaming wash and waste management to contain AMR from environmental routes. And the overarching theme for the session was prevention. So firstly, wash infrastructure, wash education and awareness, and wash behaviors will prevent infections, preclude the need for antimicrobials, and the subsequent selection pressure for AMR. In the same vein, waste management will prevent the pollution of the environment, which will subsequently prevent the evolution and transmission of AMR within the environment. And I really like to show this little infographic that I use to teach the students, in that this graph shows the progressive decrease in mortality from infectious diseases in the United States from 1990 to 1996 in the context of AMR, sensitive interventions such as clean water and vaccination. Now, if we ignore the confounder of the Spanish flu, then the provision of chlorinated water, that is clean water, resulted in a fourfold decrease in crude death rates from infections from 800 to 200 deaths per 100,000 population per year from 1910 to 1940 when penicillin was introduced. Penicillin reduced the crude death rate by a further twofold, followed by even further reductions when vaccines were introduced. What also came out during the discussion was the fact that a reduction in AMU in humans and animal health, and in fact for phytosanitary reasons, will reduce the pollution of the environment by antimicrobial residues, drug-resistant bacteria, as well as antimicrobial resistance genes. So it went up to the importance of reducing antimicrobial use in general. So when we consider water sanitation and hygiene, the key takeaways were the need to have intentional waste management at AMR hotspots. And this sort of covered waste from agricultural settings, such as manure-based fertilizers, reused water for irrigation. We spoke about health and veterinary systems, such as hospital effluent and laboratory waste, and then communities and how they disposed of their antimicrobial medicines. And this intentional waste management needed to have cost-effective contextual innovations, such as decentralized purification systems, modular plug-and-play wastewater treatment plants for the treatments of effluents at the source. Kate spoke about a number of wash-related indicators that could include percentage of population with safe drinking water, with safe sanitation, the population practicing hand hygiene in households, health facilities, schools, and public.
Sabiha, we can't hear you. Um, Rajeshwari, can we check?
Yes, I will check very
Just check
quickly.
with Sabiha. I think sometimes our lines get a little okay. If not, then
She is. I'm texting her. Maybe we can do the next. And
we
then
can do the next, and then I can come back to Sabiha. Good idea. Good idea. I have Mark actually as the next. So, Mark, thank you very much also for taking on this work. Really grateful, and it's always wonderful to work with you.
Thanks very much indeed. Lovely to see you, Sunita, and congratulations on everything that's happened in the last 2 days. So I've been asked to give some feedback on session 4, which was around really around governance and financing. We had 12 interventions. It would have been great to have had more time to have more moderated discussion, but the two slides relate first to governance, then to financing. So we heard from JP particularly around the desire for embedding AMR programs into the highest level of government, be that the offices of the president or the prime ministers. I think this is a very key, an important step. However, at the end of the day, the governance and whatever happens in the GAP comes out of GAP 2.0, it rests with the government and with our ability to hold them accountable, which came out through the discussion and through a lot of the presentations, this issue of accountability and how we pursue that. Because if 11% of all the national action plans are actually funded, it shows that there is a lack of accountability. So other models that were suggested by various speakers, there was the subnational governance model. Now that's very well known to us in South Africa. We have 9 provinces. Each province has a Department of Health, has a government, and there are block grants so that you can perhaps, it's easier in some provinces than others, I guess, to actually make interventions and to use that money wisely. But the subnational governance option was one that was put forward by a number of speakers. The other important thing is to embed AMR into other programs and national priorities. But my concern there, and a concern I think which is shared, I hope, is the challenge to ensure they don't get lost, and particularly in the pandemic preparedness accord. The use of vertical programs is highlighted, a number of successful programs, particularly tuberculosis. But again, how do we respond to that in a One Health way? Yes, TB does affect animals, but it's a vertical program which works mainly because it centers only on human health and it's very well defined. How do you make vertical programs for something like AMR, which is so complicated? Thailand's very successful 3-tier governance system of the National Committee, Coordinated Committees and Coordinated Centres was highlighted. And obviously a lot of their pioneering work from the Global South needs to be considered carefully by WHO. There was also a voice for the importance of bottom-up governance, particularly in food, the agri-food industry, the farmers being at the heart of that, and their voice needing to be heard. There's also some people suggesting sector-specific governance. However, that in One Health, really bringing in One Health is a difficult option, I think, to go down. And then the importance of subnational agencies and the role in governance of civil society and actually holding governments accountable. As I said, accountability was a big part of this. In terms of financing, there's obviously some overlap here. the desire to embed AMR financing into existing health funding streams. That again, a bit like incorporating AMR governance into things like the pandemic accord. Very difficult because of the AMR specific versus AMR sensitive funding. There was a comment about basket funding, which is this is a weighted group of financing instruments, which was used initially to kick off the SDGs. Could that be harnessed? Pooled funding mechanisms playing a greater part, such as the antimicrobial resistance multi-partner trust fund. Employing a vertical program approach to funding, as I spoke about in governance, again, complexity. There was an interjection from in somebody who mentioned the role of high net worth individuals during COVID in India, and the role they might play. Obviously, there are philanthropies and foundations like Gates and others that already are involved, but are there potential high net worth individuals in the Global South who could help with financing? The issue of external funding being unsustainable, we all know this to be true. And so it's absolutely critical that the national budget has a line, I think, for AMR. But again, that comes back full circle to the issue that only 11% of NAPs are financed. And so this comes back to accountability. Of course, data is important to strengthen the case, and the importance of the call to Global South governments for domestic financing and accountability, again, trying to go away from the outside aid and the fact that we actually have to step up and be accountable and finance these plans if they are to be anything more than yet another nice piece of paper or PDF. And lastly, again, a call, as has been often on the world stage, for finance ministers to be part of the governance structures. And every real governance committee in a country should have the finance minister as part of that on equal footing to the Department of Health and the Minister for Agriculture, etc. So that was the feedback from session 4, and back to you, Sunita. Thanks very much.
Thank you so much, Mark. That was very clear. I know we have Sabiha back. So Sabiha, can you take forward the slides from where you left off, please?
Yes, my apologies. Connectivity has been really poor here today for some reason.
No problem.
My apologies for cutting down.
We are used to this. Don't worry. We still manage. We still
Okay,
go.
good.
Don't worry.
So great. Can you see full screen on this one?
Yeah. Perfect.
So I stopped on the key takeaways for the WASH, sanitation and hygiene, and I believe that you heard my inputs in terms of the types of indicators that we would be using in terms of safe drinking water, etc. And then I wanted to highlight the findings of another WHO report that said it will cost 60 cents, US cents per person per year in the least developed countries to provide universal access to WASH in healthcare facilities, and how important that was to ensure, and how relatively economical it was to get accomplished. And the last set of takeaways was from the environmental dimensions of AMR. One of the key observations was that the AMR discourse lacks a clear definition of the environment. Do we mean the natural environment? Do we mean the built environment? And when it comes to the aquatic environment, are we talking about wastewater, surface water, groundwater, potable water, irrigation water, sludge and slurry? And all of these have their own particularities and challenges when it comes to AMR. We also spoke about the fact that the environmental dimensions of AMR has both the chemical and a microbiological components, requiring distinct mitigation strategies. And generally, capacity strengthening is required to address the gaps in AMR and residue surveillance in the environment, risk assessment and mitigation strategies, the development and enforcement of legislation, such as for discharge limits and maximal allowable limits, and technology transfer to adapt and adopt biotechnology tools for local contexts. So we spoke a lot about context-specific interventions, the adaptation aspects, and existing tools that could be sort of aligned with what was needed in the local in the local environment. So thank you very much. I think these were the key takeaways, and again, with apology for the break in conversation.
No problem, Sabiha. Tochi, can I now request you, please? Tochi?
I will write to her, Sunitaji.
Yeah, she's there. She's very much there. Hi, Tochi.
Okay, if you can just give me a moment to share my screen.
Yes, of course.
Okay. Can you see my screen now?
Yes, perfect.
Okay, so we basically concluded our own discussion a couple of literally a couple of minutes ago, about 1 hour thereabout. So and
it is incredible what you've done to put this together. So thank you very much. Thank you.
So it was really very rich discussion that we had. We had about 12 colleagues give very robust interventions. So what I have tried to do here is, to the best of my ability, try to capture what the key takeaways were. I've broken them into 3 parts. Some things that came out as key takeaways that will apply generally to every area of the Global Action Plan that's being revised. And one strong thing is that there's a need now to move from frameworks to real implementation on the ground. It appears that everybody now wants the Global Action Plan to point people and guide people implementing at the local level to exactly what they need to do to make change to happen. And it came out that sustainability needs to be addressed, and listening to everybody here, sustainability in the form of strengthening the systems that need to be strengthened, whether it's the health system, the animal health system, or even the environmental system with respect to governance at the national and local levels, because a lot of the efforts that go into antimicrobial resistance get completely destabilized once it hits the weak systems we have in some parts of our world. And then the environmental sector appears to have largely been left out, therefore creating a significant gap that this Global Action Plan must actively seek to bridge. It also came out, and more for the environmental sector as well, that there's a need to develop measurable indicators for tracking progress in this sector and find a way to integrate this into One Health dashboards and address the challenges in implementing these things, such as inadequate funding, lack of dashboards, and political barriers. To include all aspects of AMR into school curriculum, was also something that came out quite strongly as something that if we do, then we can win in the long term. And as I've heard others say here, there was also the contribution that there's a strong need to ensure that the National Action Plan is integrated into other national action plans. And I heard a concern raised by Mark when he made this comment in his own section, but for us in Nigeria, I'd like to give that example. Our National Infection Control Plan, we embedded it into our National AMR Action Plan, and then our National AMR Plan, as much of the parts of it as we could, we then embedded them into the National Action Plan for Health Security, all in an effort to maintain that coherence in planning and also to use as an opportunity to get funding, whichever of those national action plans that could be funded, and to avoid duplication and fragmentation of efforts. Then on still the general aspects of the Global Action Plan, the request to set time-bound targets for AMR, surveillance, MU, and IPC progress. I'll now move over to the infection prevention and control parts of it. Everybody did agree that IPC remains a major challenge at IPC and WASH, and that the role of IPC and WASH in combating AMR it seems to still be underestimated, in spite of the fact that it's one of the most impactful interventions. So some suggestions offered are that the next global action plan should highlight the drivers of infection and emphasize on WASH, especially things like WASH and weak WASH in rural areas, weak walking infrastructure in rural areas. And in the light of that, begin to look at ways of promoting innovative and integrated approaches to addressing the WASH and IPC issue, whether it's through financing or through technological innovations, whatever, and avoid verticalization and the artificial boundaries that are usually introduced. And an example that's been given is the boundary, what seems to be IPC when you're addressing antimicrobial resistance and IPC in general, which we all know that it's really just a programmatic boundary that is created. So the Global Action Plan should begin to promote that integration and also quantify in measurable ways how WASH improvements contribute to AMR reduction. And some examples started emerging as some attention that also need to be paid. Hello? I can hear people speaking.
Sorry, Toshi. We've, I think it's, please go ahead. I think Rajeshwari has made everybody else mute.
So then strengthening things like getting a bit more concrete and beginning to pick out the impact some specific interventions can have into general AMR reduction, things like strengthening the prevention of healthcare-associated infections, things like how surgical site infection reduction can actually contribute to AMR reduction. And in the light of that, begin to relook the health workers we pull into being champions for AMR, getting oncologists to become champions of AMR because of the impact AMR also has in their work, getting surgeons to become champions of AMR, things like that. And along those lines also to promote standard precaution as a foundation of facility-based prevention and ensure access to accurate low-cost diagnostics. This is also something that came out as what really needs to begin to be emphasized. And assess the role of IPC products that we seem now to be overusing, things like disinfectants, the effect they're having in driving antimicrobial resistance. And on the issue of vaccination, need to continue to point out the value of vaccination in AMR control, expand affordable vaccination, not only for humans, but also for animals, and also continue to promote the alternatives to antibiotics. And given the global situation around anti-vaxxers now, to take addressing anti-vaccination very seriously. And the use of legislation, especially in things around animal health and indeed the environment, to encourage prevention over antimicrobial dependence. And as been said here around the environment, manage effluents that contain not only antimicrobial residues, but also infectious waste, such as the ones that come from hospitals and abattoirs. So for infection prevention and control, these are the very high level things I could quickly pick out. We'll quickly move over to the surveillance side. Came out strongly that surveillance must be coordinated, and there was a clear distinction that was made between coordination and integration. So the first presenter did make the case that surveillance has to be coordinated across the human, animal, agri-food, plant, and environmental sectors. And surveillance done in such a way that the data, when analyzed, can translate into actionable information. And for the priorities for the next Global Action Plan, strengthening labs came out strongly. Almost every presenter that spoke about surveillance did mention the need to strengthen the labs, the laboratories, to be able to detect AMR, including the fungal pathogens. And the need to continue to expand genomic capacity. Ensure that the surveillance covers not only the surveillance in hospitals and surveillance in tertiary healthcare facilities, but surveillance down to secondary health facilities and even primary healthcare, and surveillance in communities, not forgetting the surveillance in the environment, including water and wastewater, and that these sort of surveillance should be supported by legislation and link it to improving cross-sector data sharing, coordination, and feedback to avoid fragmentation. The need to use prevalence surveys to generate representative data was also highlighted, and we have the experience for the need for this. When most countries, particularly those that do sentinel surveillance, you find the limitations of that. And once in a while, you do feel the need to have more representative data that prevalence survey can help you get. And also that data should be granular enough to identify real gaps that you can focus interventions, such as gaps in stewardship and what have you. Also, to aggregate data by infection types, but by aggregating data in such a way can pinpoint and target awareness, education, and whatever interventions that the data would require that we take as action. And to link the private sector participation to compliance through things like legislation again and expanding the platform for the private sector data to come in, and also to track the economic drivers of misuse. Scale up national surveillance systems to meet WHO GLAS, WAR, Animus, and FAO infam standards. Almost every speaker that spoke on this also mentioned the leveraging of artificial intelligence and digital tools to improve data analysis and understanding of what the data is telling us, and the value to appreciate better and bring to the limelight the value that academic institutions, their contribution can bring to strengthening data management and analysis. And as we are concluding this session, some point was made in promoting participatory stewardship as part of surveillance, bringing in the communities and the people who operate and play at the PHC level and what have you to contribute to the surveillance in a participatory way. Well, I had less than 35 minutes to put this together, but these were just the high points that came. But I really thank all the people that were in the session, very robust engagement. And I thank CSC for this opportunity to present this. Thank you very much.
Thank you, Tochi. That was brilliant. Thank you. I mean, it does not seem that you had so little time. So thank you so much. We are running about 10 minutes late, but so just hang on, people. But I think this is very, very important information, as we need to bring the 3 days together. I have Lena after this. Lena, you have an even more enviable task because you just concluded your session. So, but I know you well, so you will be brilliant. So please go ahead.
Thank you. I just want to say that I will send my notes along so that we can turn them into a PPT that it can help hopefully with the negotiations for those who are involved. So I'm going to start with looking at what people have recommended or shared from the point of view of what we can do to improve the obligations of member states, which is where, the cutting edge of policy making really is, where you get the obligations on paper and then you go for national implementation. So that's point number one, that whatever we are recommending, we have to look at whether we can turn them into member state obligations and obligations of other stakeholders. So I just wanted to highlight that. The second point I wanted to highlight that, the global context is that you have a lack of access to life-saving antibiotics, which are vital at the moment in fragile and conflict-affected regions. And it's a shame that there's been a blockade of aid that also blocks antibiotics. So you can't not talk about the humanitarian aid blockades without talking about antibiotics, because they, from surgeries to sepsis to diarrhea. At every level, you're going to need antibiotics in a conflict and fragile regions. So thank you, Shafi, for highlighting that. The first point I wanted to say is this, that a speaker very interestingly highlighted that perhaps we need to look at antibiotics, the diagnostic tools and vaccines that are developed or are used for tackling AMR as public goods, and that offers a very important role. When you recognize something as public goods, it offers governments a greater role in regulating them, in managing them, and also a greater role for civil society to ask for access as well to these public goods. So I think the language of public goods is really very critical over here. You're looking at something that cuts across therapeutic areas, and of course offers life-saving health technologies to the healthcare system, treatment providers and patients. So that's one. Then I think the WHO expert, as well as other speakers, very importantly, highlighted that we don't have enough data to look at lack of access, and what is driving it. And I think this is a really important point, and how, there's been so much said about surveillance to create data on the extent of the public health challenge of AMR. But do we understand what's driving lack of access and the lack, and we lack evidence on that? And perhaps we should encourage stakeholders as well as governments to do more about this area of evidence. And of course, it's complicated by the fact that you've had patient groups and civil society fight for much greater access for drugs and diagnostics in areas like HIV and TB, but in other areas you may have a completely different access gap. So it's complicated by the fact that different therapeutic areas have different levels of information gap. So I think this is something that we really need to look at. So one of the points that was brilliantly made by a couple of speakers was that the Global Action Plan emphasizes stewardship surveillance. It does not create binding obligations on the member states, particularly in its language on access and equity. And I think this is very important from a patient's perspective when we go to court asking for access, is that there are binding obligations that allow us to, put it at, the right to health status. So, I think this is something that we have to think about, how we're going to craft language that allows us to strengthen language on access and equity, and particularly for different populations as well. One of the important recommendations was to look at access considerations in R&D financing and R&D projects. And I think this is well said by Gajpi. Everyone said we need more R&D, but once the R&D is done, access is determined by the person who holds the rights to that product. So I think this is really very critical, that access conditions to R&D financing have to be included by member states, and as well as other stakeholders. So again, something that we can do much more about access conditions in R&D projects and financing. Now, one of the areas that majority of speakers actually agreed upon, that more resources and infrastructure was needed by state national drug regulatory authorities. And because they were highlighting that when it comes to access, the availability of quality antibiotics is a real challenge. And I think this is where, member states have an obligation to do more about addressing substandard and improving quality assured treatments for their population. So, resources for NDRAs have been a long-standing demand of the health movement, because it's very difficult to manage quality unless you have the resources to look at how they are being manufactured and stored. So I think this is something really very important that many of the speakers said, and could be crafted into, language for the action plan. Majority of speakers also spoke about weaker supply chains, stockouts, shortages, lack of effective forecasting, and then agreed upon that there should be pooled procurement, regional mechanisms for procurement. And, I would like to emphasize that, you've had secure being established and recognized in this plan. You have speakers talking about regional mechanisms, and I think it's well said, because you look at PAHO and you see that other regions can benefit from regional pool procurement. And lastly, that actually countries do have pool procurement, as for example in South Asia, a number of countries. How can we strengthen pool procurement mechanisms for antibiotics, diagnostics, and vaccines are very, very important, critical issue. And how can member states' obligations reflect those? Can we find the funding for pool procurement? So, Global Fund, one of the reasons pool procurement under Global Fund functioned was because countries were financing the Global Fund, and member states were availing of those funds to procure quality assured medicines. So while we're looking at pool procurement mechanisms, we need to also see if member states can fund pool procurement mechanisms to ensure that these mechanisms are fully funded and are able to deliver access to antibiotics, diagnostics, and other health technologies. And one very critical aspect of access was the lack of access to appropriate diagnostics. And a speaker highlighted half of the global population lacks access to appropriate diagnostics, which is driving mortality and morbidity. And diagnostic access varies across different therapeutic areas. And one of the recommendations was that member states have to set up an EDL, essential diagnostic list. Some have. We all know that. I was part of that process in India. But establishing the EDL is a very important process towards making the link that we have today between the right to health and the essential medicine list. Really very important recommendation over there. The speaker from Philippines highlighted something.
Lena?
Yeah.
Lena, I think send us your notes. Okay. Last point, and then send us your notes, please. Very
Absolutely.
rich, but we will need some time to digest all this. Okay.
Yeah, absolutely. This is perhaps my last bit. I just wanted to simply say that the speaker from Philippines highlighted that the high cost of health technologies was also, we had an obligation to reduce prices of health technologies. From that point of view, the Philippine speaker actually talked about addressing monopolies, tweaking industrial policies, and highlighted the role of universal healthcare laws in improving access. And lastly, I think one of the speakers, and I think absolutely stellar recommendation, that member states must monitor shortages and stockouts that are driving lack of access to diagnostics and antibiotics in the populations we care about, who are most excluded from healthcare. So I think I'll stop here. There was a lot more, and I'll send my notes across. Thank you.
Thank you, Lena. That was brilliant, as I had expected. But clearly, what this tells me is just how rich the discussion has been. JP, you're now in the hot seat. The question really for us, I mean, I'm putting both of us together on this, is really how, as the quadripartite head, as GLG, how do we take forward this in the Global Action Plan? How do we also take all this forward as we develop the agenda to move ahead? And I think that's really for us, and you've heard, this is an incredible gathering of people from the South, passionate, committed, and knowledgeable. So JP, the floor is yours.
Thank you, Sunita. And I will probably say the same thing you said to Lina. I mean, send us your notes. And not only Lina's note, everyone's note. I think we need this report, and really by 29 of September. So you have Amit and colleagues, you have 3 weeks. And I have put already in the chat the link to the multi-stakeholder hearing or consultations. Please also come again and make these voices be heard. I think, again, thank you, Sunita, and your team, not only for this, but for your engagement as a GLG member. And it's not the first time that you're bringing such voices together. I mean, we had an amazing experience before the younger process. And I think we sometimes, and actually often, miss these voices in the global consultations. So we really enjoyed being on call. We had many colleagues who were listening. And again, send us the notes. What I wanted just to say, and I know we are now short of time, is that the most critical aspects I got from these discussions is the urgency for practical actions to happen. And I mean, I will disappoint you a little bit. So we are only limited to a document of 5,000 words, just as a word count. So not everything is going to be found in here, but I can promise you that your notes will help us at least to agree and to document the big lines that we come up with. And I'm also pleased to say that we are aligned in our thinking so far. I mean, examples being, from awareness, general awareness to behavioral change. So that's something we all share that we need to do. More prevention. Let's face it, as the Global South, I don't think we have means to address the consequences of drug resistance infections. I mean, the big tool we have is just prevention and across sectors. I participated specifically in the governance and financing session, which Mark alluded to before. I think at the end of the day, One Health approach, better coordination, unified plan across all the sectors with accountability mechanisms is going to be the way to go. I still want to, again, to bring it back, mainstreaming AMR response into the development agenda is the way to go. I think there is no opportunity for us to have an AMR as a vertical program. And I would not even wish that should be the way to go. I think we need to be smart and mainstream the interventions into the development agenda for each country. Now, we're going to have the Global Action Plan 2.0. That is going to happen. Then you'll find yourself facing another reality, implementation. And that moment, you'll be in your own countries and you'll face the reality of lack of resources and competing priorities. And it's not a secret that now, when we look at the global development agendas, the resourcing for AMR and other global health interventions is getting scarce. So we need to think about that. So this is where mainstreaming of AMR international development plans becomes not just beneficial, but essential. It will ensure sustainability, alignment, and access to domestic and international financing streams. Now, to you, Sunita, to support countries in navigating this complex transition, we have the Global Action Plan, and then how do we, translate into something that is practical and pragmatic at a country level? I think you might be thinking of another session at some point where now we could now again meet and share practical tips and best practices for effective implementation at the country level. I think that is going to be the next task probably. Now, really on behalf of my colleagues at the quadripartite organizations, we want to reaffirm our strong commitment to not only listen to you and include your comments into our plans, but as well to support the implementation, especially when it comes to providing technical guidance, fostering collaboration, standards, and supporting the resource mobilization. I think together we can make meaningful progress. Again, a reminder, please attend in big numbers the upcoming multi-stakeholder consultations. It's on 22nd and 23rd, and your voices are going to be very critical. And send me the notes again. Thank you so much, Sunita, and the colleagues, and all the experts, and as well delegates who have shared enormous amount of good inputs that we have to consider when we updated this Global Action Plan. Back to you.
Thank you, JP, and thank you, everyone. Let me sort of help to, conclude a little bit to say that I cannot I'm not going to repeat everything that all the chairs put out, but what JP, and I think this goes beyond just talking about practical best practices from countries of the South. I think what you have heard and what you will get from us, and it is a challenge to some extent. And I find that is something that is a work in progress, but it is something that we will have to keep working on. What these 3 days of Voices from the Global South have brought are two fundamental issues. One, that we understand that AMR is an important challenge for us. We understand that it requires, however, a different pathway as we move ahead. And I think that recognition of a different pathway, whether it is for the global south or for all countries, because I believe that this voice from the global south needs to be reflected in the document, which is a global document, which says that we cannot deal with AMR unless we understand the reality of countries in the South, which in some senses are also speaking to the reality of the countries of the global North, who may not have may not have it at that scale, and so they're not able to see it. And one of the reality that comes out is the issue of the livelihood connection to AMR. The second issue that does come out is our reality of smallholder agriculturists and their need for being part of the solution and not being part of the problem. The third thing that you've heard a lot today, yesterday, and the day before is a clear recognition for the need of affordability and access. And that has to be underlined. And the fourth then is the fact that there are solutions. Those solutions will have to be embedded both in the cost effectiveness of the approach and in the reality of the different countries. And that these solutions need to be grown down to up. And they need to be understood as we are all equals in this battle for AMR. So I think what JP, you've heard me often in the GLG saying this, and I'm saying it to all of us, is to say that our voice is important. It is not a small cherry on the cake, which then gets talked about to say, yeah, there's some good best practices which we will learn. The entire plan, whether it's this one or tomorrow, should come through to understand this is the reality on which AMR solutions will be built. You and I have been partners in this for years now, and we will continue to work on this. No easy answers, but I think what I've heard over these 3 days, and I think from all my colleagues who are in this room today and have been in the room for the last 2 days, I am speaking to say we have to make sure that our voice is louder, clearer, and is heard. Because only then can a global action plan be actually global and not and be effective. And that's really what our own all desire is. So once again, thank you so much for joining me. Amit, Rajeshwari, and Neeraj, you have done an incredible job to bring everyone together. Really, thank you so much for this work. And on behalf of everyone in this room to say, thank you, thank you, thank you. We will continue to call upon you to help us to build this movement bottom up, because that's the way we are going to be able to succeed in this challenge moving ahead. So thank you. And JP, we will make sure that what we have, the voices we have heard, we will get them to you. But we have to make sure, you and I have to make sure that we can now work on this in the agenda moving forward at the Global Action Plan, at the GLG, and everything else that we do together. Thank you very much, everyone.
Great.
Really a great pleasure to have all of you. And thank you for all your voices. Brilliant. Thank you.
Thank you, everyone.
Thank you.